I was fortunate to meet my current dentist at the local community health centre. She was very open to me doing things that helped me through the sessions. I was lucky that she happened to be very sensitive to the needs of, people who had suffered trauma in the past and knew how to be gentle with people in the dentist chair rather than just be officious and treat the teeth only.
I needed to find someone who was very empathetic and caring. So what I did was I actually did some Google reviews and had a look at clinics that sort of showed that level of empathy. And that's basically how I found the dentist that I attend now.
I've had other dentists who you go to them and you feel like your only teeth and nothing else matters. And they don't care if you feel like you can't breathe or that sort of thing. And you get to feel like you're an idiot, in front of them when you have a panic attack or anything like that.
I've seen quite a few health professionals over time, from physios to doctors to chiropractors, and going to the dentist is definitely quite different from all of those experiences.
I find it much easier to go and see other medical professionals like doctors than I do to see the dentist. I think it's because with a dentist it's all focused on just one part of your body, on your mouth, and particularly for me that particularly triggers me because of my past sexual abuse history. Doctors are focused so generally on so many other bits of your body that they're less of an issue for me.
Obviously, with going to the dentist, you are very vulnerable. You're being told that you may feel discomfort, you may feel pain, and as a victim, we've already been through so much discomfort and pain in our lives, and for someone then to turn around and say that to you and then say, oh, but you're going to be okay, when you know that there's been times of terrible pain and discomfort where you haven't been okay. So seeing that and then going to see my GP is a totally different experience. My GP will give me some medication that I might require or a top up of things, and it's just a different environment. It's relaxed. They're not in my face. With the dental treatment, it's very intense. You're vulnerable. You're lying there and you're in this enclosed space and you feel claustrophobic. So yeah, I would have to say seeing my other health professionals is probably a lot more relaxed for me, and I don't feel as stressed going to them. Dentistry is probably one of the most stressful things for me to go through.
I always find going to the dentist quite traumatic. Most of the time it's fairly positive. There have been occasions where it's been really difficult, the procedure's gone longer, or there's been a problem that has come up while I've been in the chair. Even though my dentist is really good and talks to me about a lot of things and allows me to be in control as much as I can, still getting in that chair, lying down, being prone, having things in my mouth, being silenced, not being able to communicate with the dentist as well as I normally would be able to with another healthcare professional is really frightening. And I come out of it quite drained, I come out of it quite anxious, and I come out of it with my adrenaline pumping and my heart pounding, no matter how wonderful my dentist is.
Dental procedures and being in a dental chair could trigger a panic attack for some survivors of childhood sexual abuse, because you could be duplicating a situation. You're lying down, you're not in control of the situation, you're being asked to open your mouth wide and have various things put in your mouth, and there's somebody standing over you who's in a position of power. And dentists have a fair bit of power when they're dealing with us and our teeth, because they know far more than us, and we have to really take note of what they say. So you've already set up the situation for somebody who's very sensitive to what happened in their childhood, actually feeling that it's too difficult for them, and then actually starting with shallow breathing and ending up with a panic attack.
When I'm in the dentist chair, often I start to dissociate. At first, everything starts to glow and the room becomes quite surreal. Even the sounds in the room become very distant. and then I become just my mouth and my teeth. Everything else is sort of doesn't exist. My stress levels are usually really high at that point, and my adrenaline's pumping, but I can't move. I can't respond. I can't make signals to the dentist that I want them to stop or do anything, and you feel very powerless when you're in that situation. Even if I've only been in there for 5 minutes, it seems to me like I've been in there for an hour.
People don't deliberately decide, this is what I'm going to do, I'm going to dissociate, but what happens to them is that their mind decides, their body decides, this is really just too hard, and then they take themselves mentally away into another space. So it's not happening to them, it's happening to somebody else. People sometimes describe watching what's happening from being up on the other side of the room or being on the ceiling. It can happen to anybody, dissociation. We all do it at some time. Those times you've just gazed off into the distance, you've no idea what you've been doing for 5 minutes, or you drive somewhere and you have absolutely no idea how you got there. We don't need it if we've not got a history of trauma to be useful. It's just something that happens when you've got a bit of time out. But for people who have a history of quite severe trauma, in some ways it's a useful mechanism. What they need to do is then learn to control it, because you don't want to be dissociating at times when it doesn't suit you.
One of my greatest fears about going to the dentist is that they'll find something really wrong with my teeth. It's all to do with time. If I know I can just have a quick visit, I'm happy. Whereas if I think that they're going to find something really wrong, then I know it's going to be an hour-long visit, and I find it very hard to be in that state for an hour or so. Because of the way my panic attacks work, where everything narrows down to just being my mouth, I have trouble breathing and think I'm suffocating the whole time. And if I'm in for a long period of time, then it just takes it out of me, and I get exhausted by the end of it all.
My greatest fear about going to the dentist is that they're going to say, well, my teeth are going to fall out. I'm also afraid that they're going to look at my teeth and they're going to yell at me and call me stupid, or tell me that I'm lazy and that I've got bad teeth and it's all my fault.
It can seem quite strange to lay people that something that's happened 10, 20, 30 years ago can still be a very difficult thing for an adult. So some of the things that can be difficult are phrases, things that have been said to them during the abuse, like you're stupid, or no one will believe you, or you're to blame. And you have to be very careful not to say those sorts of things. Now they're the verbal cues, but the other things can actually be actions. So it can be the way somebody does something, or the way they move towards you, which duplicates what happened to someone as a child. Now they're not consciously lying there in the dentist chair thinking, oh, you know, I was abused when I was 7, but their body remembers these things and their mind's sort of taken note of them. So if somebody moves towards them in exactly the same manner, they will just flick back into that situation, even if they think and everybody else thinks they've dealt with it really well during their life. They have no way of controlling that sort of trigger.
The fear of not being listened to, not being cared for. The smells, I don't like the smells. Sometimes the latex, the smell of latex is not a nice smell for me. It brings back terrible flashbacks and memories of the assault, the sexual assault that I experienced. I don't like sometimes the smell of the surgeries, that sterile environment, the alcohol, that smell is quite, just very uncomfortable and unpleasant for me. And just the fact that you're sitting in an environment where you're not in control of the situation, so you feel vulnerable, like a victim again. You're vulnerable to it. You're basically exposed in a situation that is so uncomfortable for you as a victim and as a patient. So, yeah.
I think that my sexual assault history has made a big difference to my experience of going to the dentist. It's had a big impact on my gag reflex and my feeling that I can't breathe when I'm in the chair. I don't mind the pain so much because I can override the pain fairly easily. That's because of the abuse that sort of become easy. One of the worst feelings that reminds me of it is when they've got the, I don't know what you call it, but the thing that squirts water as well, I think it is. Anyway, that's the worst feeling of having that in my mouth, squirting water in my mouth, is, yeah, really difficult to take. I'm particularly scared of the drill, of course. The sound of it just drives terror through me. Having the dental instruments in my mouth is sort of takes me back to things that have happened in the past that and causes me to have the fear response.
I really struggle with my home care. I used to really struggle with brushing my teeth every day, and now I do brush every day. I'm using an electric toothbrush now, and I'm now brushing usually twice a day. I also have an electronic flosser called an air flosser, which means that I don't have that tape stuff that goes in between your teeth that I always thought was going to rip my teeth out. And now we're working on trying to get me to floss twice a day as well.
For a lot of survivors, one of the results of their childhood experience is that they don't actually put a high value on themselves. They don't have high self-esteem, and they don't actually think they're worth a great deal. If you don't think you are worth much, then you don't actually think it's worth looking after yourself. So they often don't have good techniques for looking after themselves. They don't exercise, they don't eat well, they don't have regular dental care, because these are all a sign that you actually think that you're of some value.
I find that when I'm brushing or flossing my teeth, the biggest problem I have is when my gums bleed, and I feel like my teeth are going to fall out, and that there's a major problem even though there mightn't be a major problem. In a way, it's very similar to being in the dentist chair, where everything becomes just focused on your teeth and your mouth. I do use intradental brushes now because of the gum infections I've had in the past that have ended up being major issues. I find that at least if I do use the intradental brushes every couple of days, that'll help stop any problems. At least you know, you're not going to go through major dental procedures as often, because I suppose I'm trying to avoid going to the dentist, so the more I can do to avoid going to the dentist, the better.
I don't have any trouble brushing or flossing. I guess now, because I've been educated with the good care that I've received through seeing an oral health therapist, who tend to have a different approach and teach you different techniques. So for victims, we have sometimes bad gagging reflexes. It's just an uncontrollable thing that we have. And I think being able to see a good professional person who can help us overcome that, maybe using things like electric toothbrushes and educating us, it's definitely helped me.
I have a couple of coping strategies that I use when I'm going to the dentist. One is that I try and think of things that are going to happen after I see the dentist, and that makes it a bit easier because it means that it's not the end of the world. It's not that I'm going there and then the world stops. I also tend to try and take something in my pocket that I can touch while I'm at the dentist that reminds me that I'm not just a mouth and teeth, and that there's something else to my world other than just my head.
I think for survivors to cope with going to the dentist, it's important that they tell the dentist they're anxious and explain that they have had a number of incidents in their life that make them anxious about these sorts of procedures. I think if they know what it is that would make it easier for them, I think it's important that they make that really clear to the dentist too. And probably what they do need is a hand signal when they really are about to not cope at all, so that whether it's that they raise their left hand or they do something, so that the dentist knows to just stop for a few seconds and let them gather themselves.
I think one of the coping strategies that works really well for me is I will put coins in my pocket and then I will feel the coins while I'm lying in the chair, and I will focus on the feel of those coins and try to work out what denominations they are, and then try to work out how much I've got in my pocket. And it just helps to take the focus off what's happening to my mouth and my teeth and stops me being aware of what the others are doing in the room. Another coping strategy I have is that I always make sure I plan something nice to do after the dentist. And then this is something for me to look forward to and to think about while I'm in the chair.
Yeah, I do. I do have some coping strategies for where I go to the dentist. When I ring and I book my appointment, I let the staff know that I want plenty of time allocated for my appointment so that whoever I'm seeing can spend time with me, that I don't want to be rushed. I have specific needs, as in whether I want to see a female dentist or a male dentist, depending on how I'm feeling at the time of when I'm scheduling my appointments. I do see both because sometimes seeing a male dentist is not good for me because my perpetrator was a male, so I'm very aware of that. And I just try really some deep breathing, relaxation techniques, and I let the staff know how I'm feeling on the day. I think the most important thing for me is letting the staff and the team that are working with me in my dental appointment know how I'm feeling on that day. I might have a good day, I might have a not so good day. So if I'm not having a good day, they can then step up and be more supportive to my needs. So it becomes about me as the patient and not me just as a number to the clinic. So yeah, that's how I tend to cope. I just let them know how I'm feeling, and deep breathing and try relaxation.
My main other coping strategy is just to go through it, just to tell myself that I'm only there for a short amount of time and that it's going to end soon, and that then I'll be back to my normal life again once it stops.
I think the main thing about working with survivors for dentists is to just remember to gain their trust, to take your time, and to work with them instead of working on them. I think learning to trust each other, so the dentist trusting the survivor to be able to give them feedback, and particularly having the survivor trust the dentist. It's really important.
I think if you're working with survivors of childhood sexual abuse, it's important to be very clear about the processes that you're going to follow. Make sure that they understand that they can stop the procedure at any stage if they feel they're not coping, and you will have to take it a bit slower than you will for people who don't have those sorts of histories.
I'd like to say to dentists that if they're working with survivors, that survivors have very strong responses and very strong fear responses connected with the work that they're doing, and that they need to be patient with their patients, so to speak, and that they need to be willing to be open to listening to what the problems are and not just saying to them, just knuckle down and get through it, because sometimes there are things they can do to make it a bit easier. Survivors have a really hard time in the dentist chair, and that they need to be aware that they need breaks, that they may not be able to even signal that they need a break, so you've got to give them breaks even, just as a matter of course, every couple of minutes stop and see how they're going and give them a break.
Just really working and listening to the patient and finding out what is going on in their head, why they respond and react the way that they do. Giving the patients an out. So it's not conditional that they have to lay there and have this treatment done if it's so unpleasant for them and they need to have a break. Giving the time to the patient. So for example, new patients in dental clinics that we know nothing about, who could be, sex abuse victims. give them an hour for a consultation. Let them talk. Let them say what their fears are, their anxieties, and help them overcome them. Work with them instead of working against them is the advice I would give to dentists.
For many survivors, they had control over very little in their childhood, that they were told things that weren't true, they had things done to them that they didn't like. So they grow up not thinking that they have a great deal of control over anything in their life. If you don't feel you have control, your life's a series of catastrophes, a series of things that happen to you. And one of those things that can happen to you is that your teeth actually start to decay, that you have gum disease, that your teeth fall out. They don't feel sometimes that they have any way of preventing this. Whereas for most people, they know if you have regular dental checkups, you have the odd filling, you have the odd cap or crown, all sorts of things will be okay in your mouth.
My advice to survivors is to remember to go to the dentist regularly. And the reason for that is if you don't go regularly, you'll actually get out of the habit of going, and then it's really easy to put it off and never go, or not go until something's really bad. The other advice I've got for survivors is to really work hard on your home care, because it can make a really big difference to when you're in the chair and the sorts of problems that you might have with your teeth and gums. So having a dentist that you feel you can work with is really important, and it's a worthwhile thing to do, to keep trying until you can find one you can work with.
It's really important for you as a survivor that that's what you are. You're a survivor. You're not a victim. You have gone through the most traumatic experience, more traumatic than anyone can ever imagine being put through. And we overcome it. So take that step, take the initiative to go and get dental care rather than be in pain. If you're having pain and toothache, you've already been through so much pain in your life with what's happened to you as a victim. Don't let that perpetrator take control again. Take control of your life again. See your dentist, see your health professional, and get yourself better.
Look after your teeth. The best you can look after your own teeth by yourself, because the more you can do that, and it's under your control, the less you'll have to see a dentist, and less often you'll have to see a dentist, and the less serious the sort of procedures you'll have to go through at the dentist. Particularly look after your gums, because if you get gum infections, you can lose your teeth and have to have extractions and root canals and all sorts of horrible things. So when you are going to see a dentist, and do have to go and see a dentist, if you can tell them that you have panic attacks and that there are some things that they can do to help, then it does help, And try and pick a dentist that will listen to you and isn't a vicious and the standard sort of old school dentist, because you do need one who can, take into account that you're more than just a mouthful of teeth to be fixed, that the actual process for you is painful and, really hard to go through.